So New York State continues to see some of the worst air quality we've seen in decades. This unprecedented spate of smoke and wildfire particulate matter coming into the state. All of New York State, with the exception of the Adirondacks right now, is under a air quality health advisory issued by DEC and DOH at the direction of the governor. Yesterday, I think everyone saw the impacts of that, the simply Dickensian skies that led into the night last night, with extraordinary levels of particulate matter statewide. New York City experienced some of the worst air quality in the world last night. Conditions seem to have worsened today. We have thick levels of smoke that traveled from the northern directions through Watertown, where we experienced hazardous air pollution levels, Syracuse, where we now have hazardous pollution levels at 438 on the AQI scale, and of course, heading down into New York City. We understand that LaGuardia is on a ground stop right now due to visibility down in the city. What do the levels mean? We talked about that yesterday. We can get into that again today. Certainly, we're talking about hazardous. That's on the AQI scale over 300. Very unhealthy between 200 and 300, and unhealthy 150 to 200. What are we doing about it? The governor, as I mentioned a moment ago, the governor, DC, and DOH issued an air quality health advisory. We have done so now for the past 5 days. We are doing it also for tomorrow. Again, that's going to be statewide tomorrow. Again, with the exception of the Adirondacks, we don't expect any relief insight from the fires that are burning across the provinces. So number two, earlier today, the governor released a statement urging all schools to limit outdoor activity, many of which have done so already, including New York City. Number three, we are doing what we can to fight fires, of course, as we always do. Our forest rangers, several are deployed now to help fight. We have a crew boss who's now currently on the ground in one of the provinces doing some important work. Again, the forecast for tomorrow is another day like today, and likely into Friday itself. We are monitoring the source of the problem as well up in Canada. Rain is forecast, unfortunately, not until next week. When that rain arrives in Canada, that will help to diminish the presence of smoke off of the fires. We will be watching, of course, the prevailing winds. It's not just the smoke; it's where the smoke is blowing, and of course, it's been blowing from the north over the last few days, as everyone has seen. Again, we urge all New Yorkers to limit outdoor activity. It's unhealthy for all New Yorkers. There's some groups, of course, that Dr. McDonald will talk about that experience greater conditions, greater health conditions as a result of the smoke. We also urge New Yorkers to limit any kind of campfires or burning. Not only are you potentially exacerbating local air quality issues, but this is a very dry state. We've been tracking a very dry state now for many weeks, and we're looking at a prolonged period of dryness, which of course gives rise to fire conditions here in New York. And we don't need our first responders running around putting out fires in New York while we're now dealing with the smoke that's blowing in from Canada. So I'll turn that over to Commissioner McDonald to give a briefing, and then we'll take questions.
Yeah, thank you, Commissioner Seagos. And I am Dr. Jim McDonald, the acting commissioner of the New York State Department of Health. If you've been looking out the window the last couple of days, you can see the effects of the Canadian wildfires. And, I think it's important to have that as context. We can see, what's going on around us here. And one of the things I think it's important to kind of frame up is, as a state, we're all going through this exposure at the same time, and there's different levels of exposure of these pollutants in different parts of the state. Central New York right now is getting hit much harder, but really the entire state is noticing the impact of this. I just want to touch a little bit on what I would call vulnerable populations. In other words, individuals who, when they go outside, are at higher risk of having respiratory problems more so than other individuals. So, people who have existing lung disease, maybe someone with asthma, chronic obstructive pulmonary disease. There are other people who have heart disease, someone who had maybe congestive heart failure, or maybe you've had a prior heart attack. These are some individuals that we would expect be at higher risk to have a harder time with the air conditions out there right now. There's other individuals too that are going to be a little bit more vulnerable. Anyone who's moved far along in their pregnancy would notice this. We have to think about some other individuals as well, maybe the very young and the very old as well. So we want to be thoughtful about those individuals in particular, that they really do try to stay inside with their windows closed. I know not everybody has air conditioning, but right now, at least right now throughout the state, the temperatures are reasonable. So hopefully, that'll be something where people can be comfortable with that in mind here. If you do have to go outdoors, and I think this is one of those things where in certain parts of the state, if you have to go outdoors, like in central New York right now, I probably would really think very thoughtfully about that, because in central New York in particular, really seeing very high air quality index numbers. But if you have to go outdoors, wearing a mask, this happens to be an N95 mask. But if you wear a mask when you're outdoors, these masks do remove particles. They do remove air pollution. Like some of you might remember before the pandemic, N95 masks were sold at these major big box hardware stores for a reason. Some people in the construction industry use masks like this, but they are very effective at removing particles. And keep in mind, the air pollutant particles we're talking about are much larger than viral particles. So these would be something people use if they walk outside. Having said that, if you don't need to go outside, particularly in central New York, would advise you not to do that. I'm going to stop right there, and I want to leave time for people to ask questions. I see there's quite a few folks on, and I think answering questions might be the best use of our time. One of the questions I just saw in the chat really quick was, is it beneficial to turn on your home air conditioner to filter the air? Yeah, I think it's always a good idea to have your air conditioning running to keep your temperature cool. I wouldn't make it so cool that it's uncomfortable. But I think it's a fair thing to do, a good thing to do.
All right, if other people have questions, you can raise your hand and I will unmute you that way. All right, I'm going to start here. We have Dave McKinley. Dave, go ahead.
Oh, yes, thank you very much. Two-parter for you. One is, how do you measure how many measuring stations do you have around Basil to get the most up-to-date information to people, if indeed that's what you do? And the other part, I'm just curious, you mentioned people with a health director. If you have problems, if you have conditions, most don't. So for a healthy person, a normal average healthy person, they're not going to keel over if they go outdoors.
Yeah, so maybe I could start with that question. Yeah, for an otherwise healthy person, it depends on the air quality index. And, one website that I find helpful, it's easy to remember, is airnow.gov. If you go to airnow.gov, it does give you the air quality index for your locality. So you just put in your zip code, name of your town, you'll find out. But for the average person who's otherwise healthy, when you walk outside, you may not notice a difference right away. You probably won't notice a difference right away. You'll walk out and it might feel a little bit thick after you've been out there a little bit. One of the things to keep in the back of your mind, if you're out walking and all of a sudden you're coughing or you're feeling short of breath, that's a signal. When your body speaks to you, you want to listen to your body. If you're coughing and short of breath, you want to move indoors, preferably to an air-conditioned space. And then I didn't really hear the first part of your question. Your audio kind of cut out, and I want to be helpful there. What was that, please, again?
Yeah, I think it was about the stations that we have around the state. I can speak to that. We have several stations around the state, almost a dozen, where we're taking current monitoring. We also work with partners at SUNY Albany, the MISONet program, and we're drawing some federal data, National Weather Service data as needed. I will also say that the default weather app on my iPhone goes right to an air quality map. That's really handy for wherever you are. You can tap on that, see the actual numbers, and it says that right now the air in Albany is at 190. So again, very handy tools that people can use to move, to understand what's going on when they're on the move.
All right, we'll go to the next raised hand, which is Eduardo Cuevas. Eduardo, go ahead. Eduardo, you're unmuted, but we don't hear you.
I'll just take a question from Michael Keller that popped up in the chat. We are looking at the weather patterns. Unfortunately, the wind doesn't appear to be shifting in a favorable direction over the next day or two. It looks to again come from the north, which is exactly where the fires are, and will continue to bring that smoke right off the fires directly south into New York.
All right, if Eduardo's not there, we're going to try Andrew Donovan. Andrew, you can go ahead. And if people's mics aren't working, then use the chat and we'll go from there.
Can't hear me, Bob?
No, he said use the chat if your mic's not working.
Okay.
Andrew, if you're talking, we can hear you now.
I just heard you.
Okay, great. Sorry about that. So my questions for Commissioner Sagos. One, we were over at the air monitoring station in East Syracuse just to see what it looks like. And you actually had someone working there. So I'm wondering if there's active upgrades or maintenance or double testing happening at these locations. It's amazing that we have one only feet from our station in East Syracuse. And the other is yesterday your teams had said that this was the worst air quality perhaps since 2002, also blamed by wildfires in Canada. Now that we're at this even worsened stage, is this the worst ever?
Listen, good question. It's certainly the worst in memory by far. I think even just visually seeing the skyline again, this Dickensian skyline across New York City and many of the other upstate cities, it certainly is unprecedented, at least since 2002. It's the worst air we've seen. As to the monitoring stations and the maintenance we do, yes, we're constantly doing upgrades to our system. We also last year, the governor launched a statewide mobile monitoring program. We have cars in 12 communities around the state that are taking real-time monitoring right now. Again, designed for a different purpose, designed to address localized pollution sources, but those are also taking readings of particulate matter. So we expect to be able to fold in a much greater degree of science into our analysis of current threats to both human health and the environment.
We have a question on the chat. What are some of the long-term health issues that can arise from exposure to poor air quality?
Yeah, so really it does talk about your lungs in particular, right? So when you're exposed to, to the pollution for a long term, it can make you more likely to have a lung infection, either pneumonia or bronchitis. And this is part of what we're trying to really get people to think about in particular. Like, and I want to make sure I'm really clear about if you have to go outside, like if you're in central New York right now, where the air quality is really, just in a very hazardous state right now, that's where you would wear a mask in particular. Because if you're in central New York and you have to go outside, when you're seeing the AQI number over 300, I would definitely wear a mask if I was going outside right now. At the same time, I have here in my hand here, 995 in particular is good. But long-term exposure, is what we're concerned about. Makes you more likely for pulmonary infections, can make you more likely to have an exacerbation of your asthma too. So part of the reason we want people with asthma not to go outside is, keep in mind asthma, once you're inflamed in your lungs, it can make you more likely to have to go back on your prednisone and use your rescue inhaler. So that's another thing in particular that's important. And, for someone who does have asthma, if you haven't had your rescue inhaler refilled, now's a good time to make sure you have that medicine at home so you're ready to protect yourself in that regard. When someone has chronic obstructive pulmonary disease or emphysema and they're exposed for a long term, it can make them have an exacerbation as well, making it hard for them to breathe. And for people with underlying heart disease, the same concern for them as well. So this is part of why we want to make sure people are very cognizant of the risks that's going on right now.
Next, we have Darla Miles from WABC.
Good afternoon, gentlemen. Can you hear me okay?
We hear you.
Okay, great. Ken, a lot of questions we're getting in the field from New Yorkers. They want to know exactly what's in the air. We know that it's fine particulate matter, but in terms of it being hazardous, could you kind of explain for us what particles are actually in the air that are of concern? Or is it the fact that these particles are a little bit larger than that they can travel to the lungs, the respiratory tract? So kind of explain exactly what's this fine particulate matter in the air and what it is, because people want to know.
Yeah, and Darla, I think that's a wonderful question that people are asking. So when you look at the air quality index in particular, it really measures 5 things. And the 5 things it measures is ozone, and then it measures something called particulate matter, and then it measures carbon monoxide, sulfur dioxide, and nitrogen dioxide. These are the things that are measured. When you have a wildfire in particular, there's a lot of things that are in the air from a wildfire, but the particulate matter in particular might sound a little bit nebulous to people, but what it means is it's something that's smaller than 2.5 microns. And Darla, I realize most people don't use the word micron in everyday language, but a hair, like one of my hairs is probably about 50 microns in diameter. So these are things that are very small. Particulate matter is very small. You can't see it with your naked eye. But particulate matter refers to all the other particles. They're smaller than 2.5 microns. And Darla, why that's important is when objects are smaller than 2.5 microns in particular, they can migrate down our respiratory system into our lower respiratory tract much easier because they're smaller. Keep in mind, some of the bigger particles are filtered out by our nose. We have hairs in our nose, we all do, and that's part of what our nose does. So I hope that answers your listeners' and viewers' questions. Thank you.
All right, next we'll go to Mackie Baker, Buffalo News.
Is that me?
Yes, go ahead.
Okay, sorry, it was weird. Like you muted it for a second. Can we talk about tomorrow? Because it really looks like from the projections that tomorrow could possibly be even worse. What are things that could happen? Like, could schools close? Or I mean, what are the things that could happen?
Well, we're looking at the conditions for tomorrow and assessing the meteorological trends and see where the wind is going to be taking this smoke. But we have already now put out again a statewide health advisory to limit all outdoor activities, certainly strenuous activities for every part of the state except for the Adirondacks. So that would pertain to Western New York. Of course, conditions on the ground will dictate the actions that folks need to take. The governor today recommended that schools in all parts of the state limit outdoor activities. So we would imagine that's going to continue tomorrow, but we'll put out updates as soon as we have them.
Thank you.
We're going to try Eduardo Cuevas one more time.
Hey, sorry, Eduardo Cuevas, USA Today Network, New York. Can you hear me now? I am so sorry about that.
We hear you.
Okay. I just wanted to check, Commissioner McDonald, New York City had issued some guidance around masking. And just want to be clear on your earlier point with, the N95 you were holding. Is that recommendation, applying statewide with these advisories, or what's the thought process there of guidance for face masks? Thank you.
Yeah, thanks, Eduardo. Right now across the state, it's pretty significant. We are, if you look at how much the air quality index has accelerated across the entire state, right now it would apply. And I think what you really have to look at is like, what is our AQI number and how does that fit in for your personal health and your personal risk? Certainly if it's over 300 and you have to go outside and you're an otherwise healthy person, if it's over 300, I would wear a mask and I'd wear an N95 like I talked about earlier. I talked to Dr. Vassan this morning and it made a lot of sense what they're recommending in New York City when you look at their level right now as well. And I think it really gets to like, if you have to go outside, a mask is a way to protect you. And keep in mind, what a mask does is it really filters the air you breathe. And I think it's important to have this in mind is when you filter the air you breathe, what happens is the particles that I was talking to Darla about aren't getting into your respiratory system. They're not getting down to your lungs. And that's how a mask protects you. What it does is it keeps the air coming into your lungs clean. So you're not getting all clogged up and then prone to infection or inflammation and exacerbating any underlying disease or putting you at risk for pneumonia or bronchitis. So thank you, Eduardo.
And Alex from the Wall Street Journal asked whether or not the next couple of days means tomorrow and Friday. So yes, Alex, we're looking at conditions that will continue to bring smoke into New York State Thursday and Friday, and we'll make a reassessment at probably on Friday about the weekend.
Okay, we're going to go to Tom Puckett next.
And I think that was my next question, gentlemen, was how soon will all of this dissipate and we're back to normal air quality?
Well, it's a good question. It's certainly on our minds. We want the fires to certainly stop. I mean, that's number one, address this at the source, and that's why we're helping Canada right now fight fires. But ultimately, this is going to continue for the next few days and likely through the weekend. we'll pray for rain up north, and pray for the winds to shift. But at this point, right now, it looks like several more days of this in New York State.
Going to go to Maya Kaufman next.
Hi, this is Maya from Politico. Can you hear me?
Yes.
Great. So the New York City Health Commissioner had said earlier today that they're not seeing an uptick in emergency room visits in the city, although he noted that could change. So what are we seeing statewide in terms of emergency room visits and also 911 calls for related emergencies? Are there upticks anywhere? If so, where? How much? And then if we aren't seeing an increase, does that surprise you at all, given the research that shows health outcomes like that from wildfire smoke?
Yeah, Maya, keep in mind, we are looking at that. We have something called syndromic surveillance, which is just, it's a way of measuring who's going into emergency departments. And we get that syndromic surveillance for when emergency medical services are dispatched. So we are looking at that. Keep in mind, you need more than a few days to say you see a trend, because you normally see waxing and waning with these type of things. So I haven't seen a trend yet, but we're looking at it. We're keeping track of that. But also keep in mind this is that because, you're inhaling this, the air that's more polluted, it may take a little bit for that to cause a problem with somebody. So in other words, someone may be out in the air today and be doing okay with it, but it's tomorrow when they might wake up with their cough, and when they wake up like, I'm not feeling so good. And that might part because it took a little bit of time for that to settle into their lungs, cause an inflammatory reaction, and then cause problems here. So we're keeping an eye on it. Keep in mind, State Health Commissioner, I'm interested in preventing problems. Really don't want folks to get sick right now. So my friends in Central New York in particular right now, when I look at your air quality index numbers, really would prefer folks stay inside right now.
All right, we have time for one more question, and let me unmute Alex Janin.
Sorry if this is repetitive. I'm Dr. McDonald. We know N95s are preferable. How helpful, if at all, are KN95s? I know a lot of people have some of those left from the COVID pandemic. Fewer have N95s. Will they do any good at all?
Yeah, they will. And I think I would use the best available mask you have access to. If all you have is a K95, they're fine. And if you have a surgical mask, that works too. And I think the point I'm trying to get here is like, you got to use what's the best mask you have available to you, for the situation you're in right now. If you have a surgical mask, for example, it's going to give you some protection. Of course, the N95 and the K95 are much better masks to use during times like this. So thank you.